Blasio right now giving us his daily briefing, stepping up to the microphone right there. Let's listen in.
Here in New York City, of course, but also in Washington that will mean a lot for us, and I'm going to speak about that in a moment. I want to explain from the beginning how important I think it is to tell you information that I believe is 100% accurate, that I believe is crucial for New Yorkers to know, and to tell you information that sometimes will be tough to hear, other times, thank God, will be hopeful and inspiring information that will show just how many people are working hard together to address this crisis, how many people are working together here in the city, but also all the people around the country are not only rooting for New York City, but are really stepping up to help us out. I'll tell you those stories and those facts, and I'll tell you the facts when they're difficult to hear but important for all New Yorkers to know. What I'm always going to be careful about is not to tell you something if I am not certain it's accurate information. A lot of times we're going to see really fast-changing developments. A lot of times we're going to have information that we do not think is complete because of this ever-changing situation, or information that might be inadvertently misleading to New Yorkers instead of giving you the complete picture. My job is to always try and sort that out and do the best I can to level with you about the challenge and what we do about it, but also constantly tell you the good news too, all the things that are being done to address this challenge. One thing I believe very, very strongly is to be honest about the timeline here. There's been a lot of discussion the last few days. You've heard people talk about the hope that we can get back to normal really quickly in this city and in this country. I want to tell you that we should not cling to that false hope. I want to get back to normal as much as anyone. And maybe after a period of time, if we saw sustained progress, really had evidence of progress, we could have that conversation. But we're seeing right now, unfortunately, a growing challenge, a growing crisis. That's clearly going to take us into April in a really tough situation. And from everything we know now, we're going to continue to deal with more and more challenges in April. And I have tried to be honest with everyone to not get into a situation where we let our guard down. We start to have false hopes. I think we're much better off being girded for battle and knowing the truth. So I believe April's going to be tougher than March, and I think at this point May could be even tougher than April, and people need to be ready for that. But the notion that everything might be fine by Easter, I don't know where on earth that idea comes from. It certainly does not apply to anything we're seeing here in New York City. And again, if that situation ever changes, I will be the first to tell you, I assure you. What we're seeing right now is huge challenges and intense stress, in particular, on our hospital capacity, on the men and women who do such amazing work in our healthcare system, and clearly on the supplies and equipment that we need to make sure we can keep moving forward. We did get some good news in the last few days, and that is very, very important to say. Supplies have come in from the federal government, from the state government, and elsewhere that have certainly improved our situation this week. That'll help us get into next week. That is a ray of light for sure. But we know we're going to have giant challenges ahead in terms of producing enough hospital space